Hello Year 10s. So today we're going to do a heart dissection. The heart is one of the most incredible parts of the body because it's the only muscle that cannot afford to get tired. The cardiac muscle tissue, if you look under it under the microscope, is designed differently to that of the smooth muscle we found on our organs and the skeletal muscle that we find in our arms and our legs. If this is going to be too gory for you, please just skip to the quiz questions. But if you'd love to see a real version of all those pictures you see in your textbooks, then here we go. Just a note before I start. When I dissect my heart, we really just tend to see the ventricles rather than the atria. It just all depends on the luck of the draw of what we get from the wonderful butcher who donated this for your lesson. So in this lesson, what we're going to do is we are going to do a heart dissection. And over here, you can see this beautiful, beautiful heart. And in fact, this is a heart of a lamb. Now, you might be surprised at how much fat there is around this heart, but we do need a certain amount of fat in order to make sure that the heart is insulated, especially we up jumping around, and it just helps to absorb some of the shock as we are moving around. Now, what we sometimes forget is that the heart itself has got a network of blood vessels to give this amazing cardiac tissue some oxygen as well. And it is when one of these little blood vessels over here become blocked that you get what we call a myocardial infarction. Now, that's a fancy name for a heart attack. When that blood vessel is blocked, then it means no oxygen can travel to that part of the heart tissue, causing that to start to die. Now, what I want to show you over here before I start dissecting this is the beautiful big blood vessels going to and away from the heart. And we've established that the biggest blood vessel is this one over here, and you can just see how wide that blood vessel is over there. This one over here, the way it's been cut by the lovely butcher in Marden who donated this, you can see the amazing muscular and elastic tissue that makes up these blood vessels over here. So if this is the aorta over here, then these over here are most likely the pulmonary veins, and they should be taking blood away. They should be transporting blood to and from the lungs. If we just follow, I'm just going to try and see if I can see where this one is going to. I might not be able to see it until I've dissected it. And if I can get it to the inside, yeah, that one's probably, yeah. So what's happening is the blood is going to travel through this blood vessel, and then it's going to fill up the atrium and the ventricle. And when this part at the bottom over here, when this contracts, it's going to shoot blood out through the aorta over here. So let's dissect it and let's see what it actually looks like inside the heart. Now, before we do that, I just want to give you a reminder. When we look at the heart, because when it's inside me, it's a different direction to when I lay it down, the right and the left hand side is mixed up. So I'm going to show you that in a few moments, but let's just dissect it and see what we can see. Because I'm doing this at home, I don't have my usual dissection kit with me. So I'm just going to go in very slowly and very carefully. If you're just patient with me. Look over here. Yep, quite happy with that. Now, some people like using a scalpel, and that works just as well. It's just sometimes a personal preference. I'm just trying to go slowly. Okay. Now, before I cut it further, there's something I want to show you over here. This is how I work out what is the right and the left hand side of the heart. Now, remember, and I'm just going to ask my assistant to get me the pen. Open it up for me, please. Thank you. If I was, this over here is my right hand side, but because of us flipping the heart around when we draw it on paper, the right hand side, my right is actually the left, and I'm going to do it down here, and my left is actually the right hand side. Now, I know that the left hand side is the thickest side of the heart, and I'll show you why in a moment. If you have a look over here, if I had to draw a very rough plan of the heart, I know it's divided into 4 chambers. The top chambers are called the atriums, so just like the attic in your house, and the bottom chambers are the ventricles. If you ever get confused alphabetically, A comes before V. Okay, now because the left ventricle gets to eventually pump blood, when that contracts, it's going to pump blood to the rest of the body via the aorta. Because it's got to pump blood all around the body, these walls tend to be by far the thickest walls. So this is going to be a very, very thick wall. So based on that, I can tell already just from looking over here, if you look on this side, you can see the wall of the heart over here is very, very thin by comparison to the wall on this side of the heart, where you can see it's at least 1 centimeter thick. I can also see over here, I don't know if you can see it over there, I can see these tendons, and those are the tendons that open and close the valves of the atria. Now, what I'm going to do, just going to try and open this up completely. Let's try and get, now the bit between the atrium and the ventricle, or between the right and the left hand side, is called the septum, and I'm just trying to open that up now. Okay, it would have been easier if I had my scalpel. Okay, I'm going to do it like that. Okay, and I think there's just one more. Okay, right, so the first thing I'm going to show you is this over here. So this part over here is that nice thick, that's the left, actually the left hand side of the heart. So this heart would be like that, okay? And what I've done is I want to show you the other half, the other side, or from the other end. So this over here is the left side of my heart, which is going to pump when these ventricles contract. This is going to squeeze the blood up over there, and if I take a straw and I try and follow the pathway out, see where we're going. sure if that's going to work properly right now. There we go. Yeah. So that's going to come out. That's going to come out through there. So what we're seeing over here, we're seeing the different chambers. So over here we've got the ventricle, and then at the top over here we have got the atrium of the heart. Now, one of the things I always find so beautiful, I'm just going to try, you can see these incredible strong, they're almost like guitar strings, these tendons over here. I'm just going to cut these ones away just to release that wall. And you can see some more over here. Now what this is going to do is, as this pulls, it actually closes the valve. This material over here is the going to lead to the valve that separates the atrium from the ventricle. Okay, let me just take that away. And I'm just going to cut that bit there away as well. Okay, right, so I'm just going to move that to one side. Okay, so there you can see, absolutely beautiful. So this here is clearly the left side of the heart. Okay, so if I'd taken this bit over here, it would be on this side over here. Okay, and which is why it's on that side of the diagram. But don't worry about the sides at the moment. What I just want you to really appreciate is how beautiful and thick this side of the heart is compared to the right hand side. And there's even a little blood clot in there as well. And over here, this is going to be, all of these over here, these fibers of over here are going to pull the valve that separates the atrium from the ventricle. Okay, let's just see. This wall over here is known as the septum, and that separates the right and the left hand side of the heart. And actually electrical messages come down here, and then it causes the heart to start contracting from the bottom all the way upwards. What we do know is that a baby's heart is in fact the size of a grape. So this is much bigger. Our heart is probably the size of a fist, so bigger than this one over here. And a pig's heart is most similar to a human's heart, and was in fact used in one of the first heart transplants by Dr. Christian Barnard, who was a pioneer who conducted the first heart transplant in a hospital in Cape Town. Now, sometimes there's a hole somewhere along here between the left and the right hand side, and that causes oxygenated and deoxygenated blood to become mixed up. Well, I hope you've enjoyed this and not found it too gory. And it's just wonderful to see some of those things that we often only just see as pictures in our textbook. Now, you could always try this at home with permission from your parents if you're very, very careful. I got this from my butchers, and sometimes you can get it from good shops as well. And you could try this yourself. If you do, let me know how you get on. And sometimes just a bit of a luck of a draw exactly where you make that dissection. Okay, so one of the things we can see over here is if I go in my left side and put the straw through here, this tells me that this blood vessel over here is my pulmonary artery, because it's going away from the heart, and it's going to go and pick up oxygenated blood in the lungs, and then it's going to come back via my pulmonary vein. We're just going to put this in here and see where it comes out. There we go. Into my left atrium, left ventricle, and then it's going to be squeezed out through the aorta, which I have managed to dissect out. Okay, so it just shows beautifully the pathways.